Going to look at stakeholder analysis in health policy. And therefore, by the end of this session, we should be knowing um, who stakeholders are and what is the role of, of conducting, what is the purpose of conducting stakeholder analysis in health policy. Um, how do you influence stakeholders? How do you communicate with them? How do you make sure that you keep them engaged? Okay, while knowing what their interests, their roles, and positions are. Okay, so we shall look at the different frameworks that can be used in conducting stakeholder analysis. So that is basically what we are going to look at. Stakeholders are individuals or groups or organizations that have interest in a particular policy. Okay, so when you conduct a stakeholder analysis, you are basically identifying, assessing the interests, values, and power of the, uh, the individuals or the groups that have influence or that can be affected by a health policy. Okay, so for example, you want to enact a policy on, let us say, abortion. Okay, so you will have organizations, you will have groups of people, you will have different entities having an interest in this matter of abortion. Okay, so uh, you can have religious institutions, you will have politicians getting interested, you will have the public being interested, you will have think tanks, you will getting interested. You will have civil society organizations getting interested. You will have NGOs getting interested, okay, in the abortion policy. So when we talk about stakeholder analysis, we are basically interested in finding out the powers, the interests, the positions of each of these key stakeholders on the abortion matter. That is what we call stakeholder analysis. So you conduct stakeholder analysis to really analyze the potential impacts of the policy. It helps you to visualize and anticipate where you're going to get resistance or opposition. And also, it allows you to identify potential alliance, people that you can make an alliance with, okay, or a coalition with. Okay, and then allows you to identify where you have areas that are going to be areas of consensus. Okay, this is very important. You need to first know where do we agree, then where do we disagree. Okay, so when you conduct a stakeholder analysis, you identify these areas of consensus, then areas of opposition where you're going to have disagreement. Point number two is that if you conduct a stakeholder analysis, you'll be able to know what other people are saying about the policy that you're trying to front. Okay, so you get to hear different perspectives from different stakeholders. And this is very important for the success of the policy. You want to have a policy where you have input from every key stakeholder. such that the policy is effective but also inclusive. That is very, very important. And then identify key stakeholders that you can collaborate with in order to make sure that the policy can actually be adopted. Okay, so coalition is also very important, like I said earlier on. If you have greater um, greater forces, if you combine sources or resources, you you often have greater chances of influencing policy. Okay, and then also understanding what their interests, what the stakeholders' interests are. Okay, what motivations do they have? Okay, this is very important in building consensus, also avoiding conflicts that can really happen. Okay, but overall, you see that stakeholder analysis, you're able to know the different stakeholders, their positions, where they are, what their role is, and what their responsibilities are. Okay, this is very important. Like I said, policies the policies need to be inclusive. When we say inclusive, that means that people own the policy and the chances of successful implementation actually. So if you conduct a stakeholder analysis, you have the following benefits. That of course, the policy will be uh, based on information that you have gathered. Okay, so it is an informed policy. You are forming a policy after getting perspective from different stakeholders. So this is most likely going to be a comprehensive policy, okay, that caters for different views. Okay, so you have a policy that has been formed as a result of consensus. Okay, and if you have a policy that has been formed as a result of consensus, owner, okay, there is ownership. Also, it is actually it's a good practice to involve people in making policy. If you involve people in making policies, you increase the chances of these policies being well implemented. You increase chances of ownership. It also promotes transparency, communication, collaboration, and you have no areas where you really have conflict about, because everyone's interests have been taken into consideration. So how do we do this stakeholder analysis? We use different frameworks that can guide us in conducting stakeholder analysis. Often, you can have a combination of multiple frameworks in only one stakeholder analysis. Okay, so for example, if you're going to conduct a stakeholder analysis on, on a policy on abortion, you can choose to use any of these frameworks, or you can choose to use a combination of these frameworks. So you basically um, have a room to combine the framework. So it basically means that uh, you have the benefit of um, masking the limitations of one framework with the advantages of the other framework if you're going to use two frameworks. So we are going to look at each of those frameworks, and we are starting with the power interest matrix. With this, you identify who the stakeholders are. Then after that, you come up with what we call the power interest matrix. We look at two things: uh, the stakeholders' power, and then the stakeholders' interest in the matter being discussed or in the policy matter. If you identify those two things for each stakeholder, it means that you know how to handle them. For example, we know that the Catholic against abortion, so that is actually well known, and most other religions, like Christianity generally. Um, you're going to look at whether they're interested in the abortion topic or not. What is their interest level? Is it high or low? Then you identify that. And then you look at what is the power of this religious institution, if it is, let us say, the Catholic. What amount of influence do they have in passing this policy? Okay, so what power do they have? Of course, power can be looked at in terms of course, power is the ability to influence. You can influence, have power. So the ability to influence is related to the resources that you have, the networks that you have. Like just you saw yesterday with the different forms of power. Okay, we have reward power, and the reward power is one of the strongest tools of policy making. For example, Uganda passed the anti-homosexuality bill into law. And then the consequence of passing that anti-homosexuality law was that the donors withdrew their their funding. And remember, about the largest part of the health budget in Uganda is by the donor. Okay, so when they withdrew, it had a lot of impact on health service delivery and also on the budget. Okay, so the budget suffered. Okay, the donors withdrew. A lot of projects were cancelled across in Uganda. While the bank withdrew its loans, said we're not going to give you any more money. So that kind of power is what you call reward power. Reward power, which is basically that I I have the ability to give you a reward, or I have the ability to punish you. Okay. So when we look at the power of a stakeholder, we need to look at the different levels, the different forms of power. Referent power, reward power, coercive power. This is using force. Okay. Of course, you have instances where if policies are passed, you have people threatening to to go and fight, okay, and wage a war against a given policy. So that is coercive power. And then you look at the reward power that I've explained, and then you have what you call legitimate power. Power because of being in a particular position in an organization. Okay, so we look at the powers of the stakeholder. Okay, don't only think about power in terms of how close you are to the president or the other powerful agencies in the government. You also have different forms of power which you really have to look at closely. So this is what we call the power interest matrix. Okay, we said that you look at two things: power and interest. I can have a lot of power, but I'm not interested in the political or in the policy issue. So I will not really bother about it. Okay. Oh, I can have a lot of power, but I'm also interested in the policy issue. So that is where you have high power, high interest. Okay. And then you have low power, low interest. If someone is having low power and not that much interested, you as a person pushing for a particular policy, you don't really need to concentrate on them. Okay. And then we have people that have high power but are not interested. Just make for you, your interest is to keep them satisfied with the situation. Okay. And then you have those that have low power but high interest. Keep them informed. Okay. And then those that have high high power and high interest. You need to monitor them closely. But of course, we look at the, 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 the strategies that you use for each category stakeholder. So high power, high interest, they have significant influence on policy outcome, and they're deeply invested in making sure that the policy succeeds. They have high interest. Okay, these are powerful industries, groups. It can be patient advocacy groups, which we have not yet, we don't really have them here in the country. But of course, with time, we shall have uh, groups that advocate for the rights of patients in the country. Okay, and then they advocate for the rights of patients in different angles through making sure that drugs are cheap, affordable, making sure that they receive high quality health care. Also making sure that if there are issues of malpractice, negligence, they can really be handled to the logical conclusion. And then you have government officials, depending on the matter being discussed. Okay, so it is not all the time that you will have government officials being categorized as high power, high interest. It is not always like that. It depends on the matter. And then you come to low power, low interest. I mean, high power, low interest. They have significant influence, but may not be directly affected by the policy. Okay. And then you have different examples. The different examples will depend on the nature of the policy that you have at hand. Low power, high interest. These are stakeholders that are directly affected by the policy but may have limited influence about its outcome. Okay. Community groups, individual patients, and healthcare workers. Okay. But if you have strong health health provider unions, then it may be a different case. And at the moment, we also in South Sudan we're not having very strong unions for the different professions. So that's it. So generally, if you have issues affecting health workers across the country, it is very hard to really bring all health workers together and have a united voice. So still, that is an area that we are still weak in. And then you have low power, low interest. The stakeholders have minimal influence and may not really be affected by the policy. Okay. So you can keep them updated and informed. Active engagement with them may not be necessary because they don't have a lot of power and they don't have a lot of interest in the matter. So what do you need to do? So the four different categories fall under the four quadrants of the power interest matrix. So what do you need to do for each quadrant? High power, high interest, collaborate with them, address issues that they raise, and then build strong relationships with them. Because at the end of the day, they have greater influence. And then the next quadrant, which is high power, low interest, keep them informed, seek endorsement if that endorsement is beneficial, monitor their potential influence. And then the other category, the third category, low power, high interest, actively engage them, provide opportunities for input, and empower them to advocate for their interests. Okay? And then low power, low interest, keep them informed through general communication channels. So you may not really have an active strategy for low interest, low power. Okay. So when you use the power interest matrix, you you are basically in good position to know who the influential stakeholders are and what you really need to do with them. That allows you to improve engagement, avoid issues or conflicts, or you can really see prevent conflicts before they really happen. And you also uh, tailor. You basically put your resources on stake on influencing stakeholders that matter. You cannot waste a lot of resources on low power, low interest. No, you want to put your resources where you have higher chances of success. So high power, high influence, high power, high interest, where you really need to put a lot of attention. So we move to the second one, which is stakeholder salience model. With this one, it categorizes stakeholders based on their salience, which is the urgency of attention needed. So you categorize the stakeholders into three categories based on urgency, proximity to the issue. Okay, and then you prioritize your efforts accordingly. So the primary stakeholders. Okay, so you basically have you have like three circles. The innermost, those who are closer to the problem, are the ones who are in the primary, their primary stakeholders. And then you have the other circle around the primary, which forms the secondary stakeholders. So they're a little bit far away from the issue compared to the primary. And then you have the tertiary, who are the farthest from the issue. Okay. So the primary stakeholders, they occupy the innermost circle and require the immediate attention. Okay. They have they basically want something to be done about the policy. They have a high urgency related to the policy and they have significant influence on its success. Okay. So you can have certain policies that will actually interest patient groups or health workers directly. So they will be the primary stakeholders in that case. And then you have secondary stakeholders, they're the ones who sit in the middle. They have moderate urgency. They are indirectly affected by the policy, and they also have potential influence over its broader context. Okay, professional association, advocacy groups, media outlets may be interested, depending on the nature of policy that you have. And then lastly, the tertiary stakeholders. They are the ones who lie in the outermost circle. They have the lowest urgency. Basically, they are minimally or marginally affected by the policy. So you can have the general public or distant agencies that may not really. For example, you have the Pharmaceutical Association of South Sudan about its agency in a policy that relates to mining. Mining is a different issue, a different sector altogether. So people in the pharmaceutical society or pharmaceutical industry may not really be interested in mining issues. So they're basically tertiary stakeholders. There is no direct way that the pharmaceutical industry will be touched by the mining policy. Okay. So what do you do in relation to the power interest matrix? Still, the understanding is the same that those that are touched by the policy have those that have high urgency are the ones that you really need to keep tabs with. So high engagement is very important. Ongoing communication with them, collaborating together in decision making, sharing information is very important. For the secondary stakeholders, you keep them updated and also you give them opportunities to give you feedback. So you can use targeted communication based on their interest. And then you have the tertiary stakeholders. Um, these ones, the general information about the policy can work. So the broader communication strategies with generally with the public and things like that. That's enough. It's nothing much. Still, the benefits are similar to the power matrix, the power interest matrix. You are able to to use your resources in areas where there is greater need. Okay, and then you can easily identify the people who have high urgency. Easily identify the stakeholders with high urgency, allowing you time to really address the issues that may prevent the policy from going ahead. Okay, and then adapts to the evolving policy landscape. Okay, you can have stakeholders who shift from one policy position to the other. Okay, so it means that when you use this framework, you can be in position to identify who has shifted from being secondary to being primary. You can also have those who are being primary stakeholders moving into the secondary category. The third is the network mapping. With this, you basically have you have a graphic that shows the relationships and the power dynamics between the different stakeholders that you have. Okay, so for example, in the abortion policy, you will have you create a map. You have these different stakeholders that you put. Uh, you will have the Ministry of Health, stroke the government, and then you will have the religious leaders, where it would be prudent for you to categorize them, whether it is the Christians or or you are going to categorize them into the Pentecostals, the Catholic, and then the Protestants, and then the Muslims, and then others. And then you have the the health professional associations or unions. They could also have an interest in the abortion policy. Okay, and then you will have the NGOs. So you have listed all these different stakeholders, and now you need to know how the religious wing um, influences the government, or how the government influences the religious wing. Okay, so you see who can influence who, and who basically has what position. So this kind of visualization of drawing allows you to know who the key influencers are, um, how the information moves from one stakeholder to the other, information flow, and then potential coalitions. Who can you make a collaboration with? Who are the potential people? And then the knowledge gaps. So this kind of visualization is very, very important because it gives you a complete picture. Um, in one of the ways which public health professionals should be offers that with is what we call the systems thinking. Okay, so you need to know that we have different agencies, different interest groups, different stakeholders. How do they influence a particular stakeholder policy issue? Okay, so you can use computer programs to make for you the network the network maps. Okay, where you have the different actors being illustrated as nodes or circles or squares, and then the lines, how they relate with one another, are the ones we are calling the edges. And then um, the extent to which they communicate or interact with one another can be depicted in terms of the thickness of the lines. Okay, and then we have the arrows indicating where the information flows, how information flows from international agencies, the government, or Ministry of Health, or how information moves from Ministry of Health to the public. So you have all those arrows to illustrate the, the network and how information flows. Okay. When you use network mapping, of course, it allows you to categorize the the stakeholders in terms of uh, their the level of knowledge that they have on a particular policy issue, and then therefore you can be able to know how to influence that kind of flow of information. Okay, so it gives you room to therefore engage strategically. Okay, approach the issue when you really know the whole dynamics, you know the picture. Okay, it is not very wise for you to approach the issue without having a very good interpretation about the dynamics of the different stakeholders that you have. Okay, so you really need to get this in order. Do your homework. Do your homework, and then engage uh, efforts that can really give you good results. Okay, so that is very, very important. You minimize resource wastage, you tailor your engagement, you have very good understanding of the dynamics, and therefore you limit chances of encountering resistance. So you can really mitigate these challenges. And then the advocacy coalition framework You basically need to know that for any for some policy matters, you will need to form coalitions. All the different stakeholders will actually form coalitions. They will come together. The different stakeholders will come together. For either proposing the policy options or for resisting certain policies. People will always come together. People of common interest will most likely come together and form an alliance or a coalition. So when we use the advocacy coalition framework, we want to see what coalitions are available, which ones are against, which ones are pro, and what are their resources and beliefs. Okay, you need to know these coalitions and then be able to really deal with them in a proper way. So, what are the core concepts in this coalition, advocacy coalition framework? With this, you basically need you look at which coalitions have the deepest concern about a particular policy issue. Okay, which group of actors have a deep core belief system about a policy, a particular policy issue. Okay, and um, what strategies are they undertaking to basically deal with this issue? Okay, so you need to look at it could be unions, patient advocacy groups. It could be healthcare unions. It could be industry representatives. It could be government agencies. It could be people in the academy. Okay, you can have a coalition of tertiary institutions. You can have a coalition of private hospital owners of South Sudan. You can have a coalition of private secondary school owners of South Sudan, so something like that. So you have different coalitions, people coming together to form groups that want to advocate for uh, their interests in a particular policy. So if you have, for example, a government policy that is unfavorable, or for example, if we have um, the government saying that we are going to abolish all privately owned secondary and primary schools. One of the coalitions you will see is a coalition of secondary school owners in South Sudan combining with primary school owners in South Sudan. So you have a coalition of the owners of primary schools and secondary schools. So when these people come together, they're actually a very big force. For some of the owners of these schools are government officials, they are very powerful investors. You have even uh, international investors who have come to invest in South Sudan in secondary and tertiary and the primary schools. So, and these investors would also be having connections with the different embassies. You have an investor from maybe let us say Sweden or Norway or even UK. So for you, you could be in the Ministry of General Education, and then all of a sudden you receive a call from the embassy. You're like, okay, we are dealing with the issue of secondary and primary school, but how did it reach the embassy? It's because one of the owners of these schools is an investor, an external investor who has ties, who has to be protected by their embassy when working in South Sudan. And then from nowhere, you hear a phone call from the Minister of International Collaboration, okay, or Minister of External Affairs. Okay, so you see that something was small, but now it is now involving bigger powers. So you will have those issues there. So what is their belief system? What are the core values, principles, and assumptions that guide the action of these coalitions? So when these people come together, what are they fighting for? What is their belief about the matter that is being fronted? That is very important. And then policy entrepreneurs, we looked at them in our earlier presentations, especially in the policy making process. We have individuals we call the policy entrepreneur. These are individuals, organizations that have a key role to play in making sure that a given agenda or a given policy is actually formulated, implemented. Okay, so they are very important in mobilizing resources, framing the problem, and also building alliances to advance the coalition's agenda. Okay, so in that coalition, you need to look at who are the key people there. Who are the key people that are driving the coalition? And then the subsystem um, is very important for you to note that this coalition comes from different agencies, different associations, different groups, different unions. Okay, so that means that um, if you're looking at a health matter, that health matter can result into coalitions of people from different sections of the health industry. You can have those who are owning hospitals, you can have those who are owning pharmacies, you can have those who are owning imaging centers, you can have those who are owning nursing homes, you can have those who are owning medical schools. So what are the subgroups or the subsystems within that coalition? It's very important to also look at them in detail. Okay, so this framework gives you a deeper look at the analysis of who are these people in this coalition, what their interests are, what are their resources, who are the key personnel. Then it allows you to strategize properly. Then we look at the 7 P's of stakeholder engagement. With this framework, it provides a comprehensive framework for engagement of stakeholders through the policy making process. So it covers the 4 P's, the 7 P's, which include the purpose, people, plan, process, participation, power, and products or output. Okay, so we're going to look at each of those P's. The first P is purpose. What is the purpose, or what is the objective of stakeholder engagement, and what do you want to earn? What end result or what outcome do you want to achieve in this engagement? Okay, so that is very important in really such that you don't waste time with the wrong people. You really use your resources in an appropriate way and have an articulate plan. If you're going to meet a particular stakeholders, have a well laid down plan for how you're going to achieve the desired outcomes. And then we have the people. Identify and map all relevant stakeholders with vested interest in the policy. So you can use the other tools that we have already looked at, the power interest matrix, stakeholder salience model and habits to identify the people who are influential, who have interest in the policy issue. And then plan. Develop a strategic plan outlining specific engagement activities for each stakeholders, for each stakeholder. Okay, so you're not going to communicate to the different stakeholders in the same way. Okay, uh, you will have different communication strategies for each stakeholder. And I think one of the lessons that we shall have is communication strategies in health policy making. Okay, so you need to make sure that you have communication strategies that are well tailored to the different audiences. The way you're going to communicate on radio is not going to be the same way you're going to communicate to the Union of Doctors in South Sudan. Okay, the content can be slightly different. Okay, and then your planning should consider cultural sensitivities and accessibility needs or when designing the engagement activities. Process. Ensure that you are transparent in your engagement process with the different stakeholders. This will increase trust, okay, and the trust, and also people will be open to you if you are actually very transparent in the way you do things. Okay, transparency, timely updates, ensuring that they can give you feedback. It's two-way communication. Um, that's very key. And then we have participation. Okay, you don't want to always be the one leading the discussions on a particular policy issue. You also want them to really give you to give you their perspective in an active manner. So they should participate, meaningful participation, not one way giving. For example, if you're engaging the community, the engagement should be a meaningful one where you also actively listen to their concern. Okay, not you throwing your policy proposals to them. And then power. Okay, we have already seen that different stakeholders have different levels of power, and that your interest could be more on those who have high power and minimize a lot of investing a lot of resources to people who have less power. But you can still advocate for them if the policy issue directly affects them. Okay, you can have, for example, you can have a community that is being affected by pollution from oil fields. These communities are poor. They are poor communities. They don't have power. Okay, they are powerless. But the policy issue touches them. They have high interest in it. They cannot really voice their concerns. Okay, so that means that they have high interest but low power. That does not mean that you cannot really engage them. You can still engage with them, and also voice their concern. Okay, so advocacy in this in this sense becomes very key for such marginalized groups or vulnerable groups. Then the last P is product stroke output. Clearly communicate how stakeholders' input will be considered and incorporated into the policy decisions. Provide feedback on how engagement activities have influenced the policy. Okay. So the benefits is that it is very systematic and comprehensive. It covers all the aspects of stakeholder engagement. It increases legitimacy and ownership of the policy, and there are chances that the policy can have positive outcomes. Increase the transparency and accountability. and this thing if you use this framework. The second last model is the mental models approach. This one's like you focus deeply on the stakeholders and you look at the mental representations of the, these stakeholders. So you look at aspects to do with their knowledge, their perception, assumptions about a policy issue. Okay, you can have a very good policy that is going to have very good impact on the stakeholders. But if their assumptions and the perceptions are not the right one, they will resist it. Okay. So, for example, if you want to build a refinery in a particular community, okay, so people have been living in the area where the refinery is going to be put. Controlling information flow becomes very key because most likely the indigenous communities can resist such a development because of misinformation that they have about the proposed refinery. Okay, so that's why managing information, changing perception, and assumption becomes very key in succeeding. Okay, and we have seen this with even issues to do with COVID-19 vaccinations. Okay, there were perceptions that um, foreigners want to kill Africans through the vaccine. Okay, we have a lot of misinformation about vaccine during that. The vaccines will make you barren. The vaccines will make you impotent. Okay, so the uptake was quite low because of that. Okay, so when you use this model, you're able to enter into people's minds and look at what are their knowledge levels, perception, and assumption about the policy proposal. Okay, so you look at them and then see how you can address these issues. Okay, uh, provide the accurate information about the policy, what the policy desires to achieve, and explain any issues that result into negative perceptions. Okay, and also involve them in the decision making process. The way people interpret information will influence how they make decisions. Okay, so it still comes back to the fact that we need to recognize that some policies fail because of the flow of information, because of assumptions that people have about the policy. So these need to be addressed through proper communication strategies during policy making. So you can apply it in different situations relating to health policies. But of course, for you to be able to understand their perceptions, their knowledge levels, you need to do surveys, collect data, interpret, analyze the data and interpret, and then document through different reports, and then have strategies to address some of the issues raised through the surveys that you have done. Okay, so using this model is quite uh, is actually beneficial because you get to tailor your communication strategies according to what you have really gathered. You really know that people are opposed to this policy because of ABCD. So you are able to explain some of the things and then to minimize resistance. The last is the actor network theory, which we also saw in one of the frameworks about policy making. Okay. So with this, it is very important for us to realize that policies are shaped also through relations that people and that individuals and institutions actually have. These policies don't happen in a vacuum. We are human beings that have social networks, okay, social and natural networks that we have relations with people within, even outside given communities or groups. So understanding this is very, very key. Okay, you need to know that there are networks within uh, different stakeholders. So we have different concepts in this action network theory. We start with the actants. Everything in the network is considered as an actant. So this is to say that when you are looking at a policy, you may not necessarily need to look at people who will be affected by the policy alone. We have other elements of policies, the technology, the humans, the objects, the the conceptual ideas around the policy. These are all uh, very important in influencing the network. Okay, so the relationships and connections between these uh, form the networks that can continuously change and not fixed. These networks are made up of different elements that can be conforming and those that are actually conflicting. Okay. And then translation, the process of bringing actors together and making them one as a network is what we call translation. And then performance. Networks are constantly being performed and reproduced through ongoing interactions. What does this really mean? Is that when you're thinking about policies, you need to keep in mind that uh, even humans have attachments to certain objects. And it is very important that you don't really look at things in a simplistic way. Okay. One of the issues, for example, that I can use as an example was in Kampala, there is an old building which was built in the early 90s, and it is in the middle of the city. So the city council authorities wanted to demolish the building and build a modern infrastructure. People refused. So people opposed the idea. It's not about modernity. That's what they are saying. It's about maintaining history. So people are not detached from objects. In that case, which is basically an infrastructure. People have connections with the objects, with infrastructure, with things around them. So you really need to interpret policies in that way. Okay? Because people have a different attachments. So you don't need to look at things in a simplistic manner. Go beyond that kind of explanation. Look at it, because if you don't pay attention to it, then you are likely not to really succeed. Okay, so just know that different actors or actants exist. It's like an open system where um, networks or the actants behave in uncertain ways. There's dynamism in the way the reality is actually. Okay, so you really need to pay a lot of attention to such. Okay, So it can be applied in a number of fields, okay? Whether it is science and technology, public policy analysis, organizational studies, and things like that. Okay, so that marks the end of this presentation.